Hi, I'm here with Honor Lean, the Executive Director of the Northwest Healthcare Response Network. Thanks for joining us today.
Thanks for inviting me. I'm happy to be here.
What is the Northwest Healthcare Response Network and what do you all do?
Well, the Northwest Healthcare Response Network is a nonprofit organization. We lead a coalition of healthcare organizations, healthcare providers, along with public health agencies and emergency response agencies, all working together to help ensure that our healthcare system is getting ready and more prepared and more resilient for any kind of public health emergency or disaster.
What does preparedness look like in terms of climate emergencies in the healthcare setting?
It's similar or the same to what a healthcare organization might need to do to prepare for any kind of emergency. So for example, we want healthcare organizations to have robust emergency plans and think about all the different kinds of hazards that they might need to respond to. We need them to think about what are the steps that they need to take to make sure they can continue to provide care to their patients. Or if there are more patients because of the emergency, how are they going to surge? We need them to have good communication plans. So how are they communicating with their staff, with patients, and their community response partners? They should also be thinking about what kind of supplies do they need to respond to an emergency. All of those things are important components for any kind of emergency. But if we think about climate hazards, we really want organizations to be understanding what are the hazards that are most likely to affect them. That might be wildfires, that might be floods or heat-related responses. So organizations should really be assessing the hazards and the climate hazards that are most impactful for them and thinking about what might be different. So are there different supplies that they might need to respond to those hazards? Are there different training elements that their staff need? Are there things that might affect their operations differently? Like if there's a lot of wildfire smoke, how are they thinking about air quality? Or if there's extreme heat, are they thinking about the impacts of that heat on their air conditioning or their equipment, like their X-ray machines? Are they thinking about messaging that they need to communicate to their patients? All of those are some additional steps that organizations can take to help prepare for climate-related emergencies.
Walk us through an example, like the 2021 heat dome, where we had excessive heat for nearly a week and early in the spring and summer season.
Yeah, we learned a lot during the heat dome of 2021. So there are some important steps that organizations can take, and some of them are similar to things that I just mentioned. So we want organizations to be making sure that they've assessed what the impacts might be to their supply chain, as well as to their equipment, like X-ray machines, like computers and data and all the technologies that healthcare organizations rely upon. We want them to be thinking about the impacts to their patients, and if they can be proactively messaging things to their patients, helping to push out public health messages, helping to ensure that their patients understand what might be things that put them at higher risk due to heat that could make them more vulnerable, and what steps can they take to help reduce that impact. In particular with heat, it's folks with chronic disease, the elderly or young children. And then when we get into a response, we need those organizations to activate their emergency response plans, implement any steps that they need to take in order to respond to surge, and we need them actively engaged in the community's emergency response. And we're very fortunate in this region that healthcare organizations and the hospitals are so collaborative in working together. So we will have regular conference calls, regular coordinating meetings where they're getting together, they're sharing information with all of us about what their impacts are, what their capacity is, are they seeing unusual trends or types of patients that are coming in. They'll be identifying and working with public health to help us identify, are there new things we can do to mitigate the impacts on the community? So as a part of their preparedness, they have to be working internally and also be prepared to be coordinating externally. And that response coordination will happen until the emergency has ended.
Thank you. So how do healthcare systems work with public health during a climate emergency?
So a lot of that collaboration starts in the preparedness time. So identifying what those hazards are, what are the areas of most risk to patients in our community, and what steps can the healthcare system and our response be taking to mitigate those impacts. When we respond, healthcare has an important role in sharing information with public health. So if it's something because of a disease, there's information around disease trends and the number of patients that healthcare might be seeing. If it's a heat-related emergency, ensuring that they're doing all of the appropriate reporting on heat-related illness and impacts that they're seeing in terms of patients coming to their organizations. If it's a wildfire, being prepared and coordinating with public health, both on steps they can take to protect their organizations, but also sharing information about impacts they're seeing to their populations. And I can't overstate enough the importance of healthcare being a part of those trusted communicators that can help get out public health information about different risks and what impacts they might have to vulnerable populations and steps people can take to protect themselves. And we really need all providers and all healthcare organizations supporting public health and being a part of that messaging to their patients and their communities.
And if you're part of a smaller clinic or health system with fewer resources, what are some options for you?
There's good tools and good templates, tip sheets, and various things that can help organizations that don't have a lot of resources work on some of the basics in terms of their own organizational preparedness. I think it's really important for any size organization to think about what its role will be. How are they going to communicate with their patients? How are they going to communicate with public health and emergency response agencies? Have they identified what their staff roles will be, and have they trained staff on what those expectations and those roles will be so that they can continue to provide patient care when their patients in the community need it most? We really need providers and healthcare organizations, large and small, helping to communicate that public health messaging with their patients so that we can hopefully reduce the impact of injury and illness on our most vulnerable and everyone in our community.
And my last question, where can one get more resources about this?
Well, the good news is there's so many organizations putting out good resources. So I'd have to say my organization has some. Public Health Seattle King County, the King County Emergency Management Office, the State Department of Health and Emergency Management, as well as a lot of resources from our federal partners at the Centers for Disease Control and Prevention. There's a lot more resources coming to bear these days. And so a lot of things that healthcare organizations can access to help them prepare and respond effectively.
Well, thank you, Honora. That was really helpful and informative. And if folks want to learn more, please check out their website at nwhrn.org.